welcome and introduce our Suresh Rao, and he will take the lecture.
Yeah.
Okay.
Before that, I want others to switch off your mics.
Yes.
Govind Bharani sir and S.P. Pansar, your mics are please switch off. Thank you. Good evening, everybody, and welcome to our evening's program. Today, it will be our guest lecture program as usual, Mr. Kumar, and our old member, LPHA member, Suresh Rao sir, will be handling this session. He will be talking about urinary infections and kidney stones. You all know Suresh Rao sir. He has been always with us in the program, and he is an IT professional. He has 26 years of IT experience, and he is now heading Reliance Retail as a retail IT head in the Reliance Retail business. And now we can hear his homeopathy experience of his homeopathy practitioner. Suresh Rao sir, I welcome you to today's program. Please say
Good to all. You were able to see Anup?
yeah, we can see.
Good to all. Today I am going to take urinary system in the two types. One is kidney stones, which is a process of kidney stones, and one is on the history of the kidney stone and the UD, and also for the carbon solution how to avoid the reoccurrence of the kidney stones. Also, I will say the UD also. So you see what is the urinary organs, as a everybody we know what is the kidney stone, iron and phosphate, like male and the female also the same systems. So now I am trying to talk about the kidney stone. Usually kidney stones forms due to the dehydration of the drinking very less amount of water. And also here lifestyle of the families, because a lot of people are living in the coast environment, where we are not having safety and we are not taking enough amount of water, which leads to formation of the calcification in our kidney. Usually this also forms one of the reasons of the taking of more high protein and also salt and sugar. This also leads to the formation of the kidney stones. And also obesity of the people where the name is varies lot size, and also digestive disease also where digestion is not proper, where it leads to the formation of the kidney stones. Other medical condition also there are the where it forms because of the acid is low acid forms also we form to the kidney stones. And also here where we are taking the more supplementary of the antibiotic like vitamin C and the dietary supplementary also leads to the, and where we are taking a lot of calcium based tablets from the auto which is not getting dissolved in our body, that also leads to when we are filtering in the kidney, it also forms as a calcification. is also called as a capillary or a nephrosis or the ureterosis. Usually, as I said, the main reason for the kidney formation is the what?
The slides are not moving.
Sir?
Slides are not moving. You can make it full screen. Slideshow. You do that slideshow.
No, sir.
On the top there is a list of things. Home, design. You click the slideshow. On this side, on the left side. Home side. Home side. The other side. On the other side. The opposite. Yeah, there you can see insert, design, transactions, and all that. Then you have slideshow on the top, above that, on the orange area. Above that, there's a slideshow written there. Slideshow, animation, above that, on the orange border. Yeah, and there's slideshow is there. After that, slideshow is there. After animation, slideshow. Yeah, click that. Yeah. Then from the beginning. From the top there is a beginning, on the left side. Yes, close right, yeah, click that. Then from the beginning, yes.
Yeah, now you have to say about.
Yeah, you said from the beginning. You said, yeah, click that. And now you can move the slides.
Dehydration, and now we are talking about there are the 4 types of kidney stones are there in the human.
That slide is not speed, that slide is not speed.
No?
Yeah, you can click that from the beginning.
One minute.
From the beginning. Yeah, from there. There, click that.
Yeah. Now?
It's not showing the beginning slide. Now this way. From the beginning. There, don't touch that. Don't touch the slides. You go to the other straight above. From the beginning. There is a, click that. Not there. You have gone over. There. Click there. Click on the there. From the beginning. Yes. Yeah, there. Click there. Not there. Just below. Yes. There. Yes.
Okay, now you have to see.
You can see that when you move in this slide, you cannot see anything else.
Now?
You can see the urinary system is there. Then next slide you move the next slide.
Yeah, I am moving.
Picture is not seen.
Okay.
Now it is moving. Okay. You can you put upward downward arrow. Yes, sir. Okay. Yeah. Now it's moving.
Okay. Usually these kidney stones give the symptoms unless otherwise it is getting moving within the kidney from kidney to the urethra, the bladder. So the pains usually comes like a abdomen pain or the back pain. So when the kidney stone moves from the kidney to the bladder to the urethra, then there will be pain because the urethra dia is very small, say 4 to 5 mm. If the kidney stone is more than 4 to 5 mm, when it is moving from the kidney to bladder via urethra, you will get pain in the abdomen and also in the back pain. So that is where we are able to see what is the pain causes to the kidney. Shoulder pain will be there in the side or the back of the ribs. Pain is also from the lower abdomen and the right. So usually people are getting, and also there will be some sort of even passing also will be very difficult for them to pass urination, and there will be also some burning sensation there. So this is also the causes of the kidney stone in the causes. Okay, passing very it will be very difficult to pass, and the main people are coming with is back pain and also lower abdomen pain, and also very difficult to pass a urine because this they get stuck in the urethra, so we are not able to push the urine. There are four types of kidney stones are there in the people. Now we see first of the calcium stones. Calcium stones forms only with the calcium oxide. It means that the oxide substance is depositing in the kidney where we are not taking adequate amount of water. So it forms as a calcification inside the kidney. Okay, the constitution is also taking more protein and not taking what you call less amount of water, and also taking 8 doses of vitamin D. And it also it is plays a major role for the to form a calcification. Next, you can see the storage stones. Usually, this stones forms only because of when there is a UTI problem. Because there is a when you are having the UTI, there is a urinary tract infection. The stones form and grows quickly and become quite large also. So usually in a human being, we are seeing only calcium deposit stones only are there. These are very rare. And there is a uric acid stones. Where uric acid comes only because of where we are taking lot of high protein, where it is not getting digested properly. Again, I told you wherever we are having digestion problem, so there also we will be getting a formation of the calcification. The fourth one is the cistern stone. This is usually comes when there is heredity of the kidney stone from the kidney. Now first we will see what are the medicines available in our homeopathy. That is where there is belladonna, osmium can, and Araya, Breva, and the Sarasapilla, Lycopodium, Axonic. But in the case study case, because I was from the 2000 beginning of January, I was suffering with the kidney stones. First I got a heavy stomach pain from morning. The lower abdomen pain is not able to tolerate, and it is persisting from morning to till evening. But I am not aware because of the lack of knowledge. I thought this is only some stomach pain, so I left it. After that, when I take a ultrasound scan, then it is we found that there is a 4 mm of calcium in the kidney, that causes the kidney stones. That's the reason for the stomach pain for me. The second time when I was traveling from Trivandrum to Chennai, again I had the same back pain. Heavy back pain. I thought there is only a gastric problem where I am not able to quickly came to the solution that it is because of the kidney stone. So usually people get abdomen pain and also back pain. So in my case, for the past some 10 years I was struggling with this kidney stone problem. So the case studies from my experience I am sharing. I used to take BV, that is regular 6C in the water dose, and belladonna 10 mg water dose, and the osmium can give in the water for 30 ml. I used to take this all the 3 medicines consecutively for every half an hour. So my some 3 to 4 hours I took this medicine, regular that is 6C, the osmium, and the milk 10 mg. So because the experience, the kidney stones moves from my kidney to urethra of my bladder. So at that time I had a very bad back pain. So when I am taking Bell and the BV and Osicum, these stones moves from the urethra and they came to the bladder. Once it reaches the bladder, then the pain reduces. So this is my experience with this our homeopathic medicines. I have undertaken because I was studying for some 3 to 4 instances where the kidney stones, the heavy back pain. That is my my own experience. After that, I used to take the Morgan those 200 potency for every week, which prevents for the formation of the calcium. So that, and also Fragile also helps us for this kidney stones. Apart from this, we are having a lot of medicines in our homeopathy, like where the stone forms. There is the calculate bladder for calculate. You see that there are so many diseases are there. Arnica, and the benzoic acid, calculate and cannon, lycopodium, and sarsaparilla, staphylia. Lot of diseases are. So through the taste only we have to administrate the medicine and we have to give the medicine to the patients. So there are the these are the are you able to see my Excel?
Don't use the mouse to move, you just use the up or down or down.
Okay. రాత్రి ఎంత పంతాల ఫోన్ చేస్తాను రేపు కోవిడ్ క్లాస్లో ఉన్నాను.
You will have to see the Excel now.
Yeah.
So there are the because I have taken some degree. What are the medicines available for the each case studies? Like you can take when there is a calculating the bladder, we can use lycopodium and hydrangeia, and when the calculate there in the renal area, we can use nuts and also berberries and also lycopodium. So each case studies we have to administrate the patients and we can give the medicines. I'm not able to move my legs.
Up or downward arrows there.
Yeah.
హలో
Pick the column and person there.
హలో
Just try FLT and see.
Are you able to see?
Yeah, we can see.
So told
It's gone.
where are the
It's gone.
Hello.
It's gone. It's gone.
Hello.
It's not there.
it's gone, huh?
Yeah.
சொல்லுங்க முடியலையா? கொஞ்சம் இருங்க பார்க்குறேன்.
Is it okay?
No.
இப்போ எல்லாரும் வந்துட்டாங்களேம்மா.
Yeah, it's done that is.
So
நான் பார்க்குறேன் பாருங்க, இல்லைன்னா நான் ரெக்கார்டிங் அனுப்புறேன். அப்போ பாருங்க, இப்போ எல்லாரும் வந்துட்டாங்களே, அதையும் இது பண்ணுறேன்.
we can use the medicine according to the symptoms from the patients. For example, when there is a issue in the kidney, we can also use the antivenom food also. When there is a lower abdomen pain and also in the kidney stone. When there is a after operation, suppose because some of the people are doing the operation for the laser type of treatment where they are breaking the kidney stone from the bigger size to small size. In that case, we can also do like Steffi, we can also give a army also for that. Suppose if the kidney stone during the passage from the calculus moving from the kidney to the ureter, we can solve the glosoma. Which this is a very rare remedy available in our body. So as I told already, when there is a cramp, pain in the uterus, there is a calculus, we can use the Benuron. I told you because I usually bring 10 m because the stone was moving from my kidney to the bladder. So I used the high potency of the Benuron for more than half an hour or continue for 3 hours. And also we can also use the alkali carb also in the pains happening on the passage of the alkali. And the prevention, as I told you, calculus nails also we can use when there is a pain in the alkali. And also we can use iodine is also one of the best medicine where we can reduce the size of the kidney stone and also it will also become weak. Now we go to the next urinary tract infection. Urinary tract. Okay. So urinary can you see now? Now? Okay. So UTI usually this comes usually from the kidney stone disease and the various sexual activity and also prostate disease and also your low immunity in the body also will cause a UTI. And the obstruction of the flow of urine because
సార్ నమస్కారం చెప్పండి.
people getting very causing urine by drop by drop. That is also one of the reason for the and also your food allergy. It's not moving, no?
Not moving. It's not moving.
Sir, can I intervene?
Yes, sir.
Sir, actually you are not playing your PPT, you are only opening it.
That's correct.
Yeah, you please, in the below there is one hourglass one symbol to there. Just play that.
No?
No, still it is in the open statement, it is not playing. Play that. If you play, the left side panel should not be visible.
Correct. That is there. You can say the slide selection is the current slide from the current slide of the online. Like that is the current slide is there.
Yeah.
You put the current slide on the.
Now? Now is it okay?
It is not opening. It is just that, as he said, the side panels should not be seen. Only the full screen has to be open.
Come to the below. Below icons is there, no? On the rightmost side.
एक मिनट sorry एक मिनट अगर the जाना तो क्वेश्चन है ना तो क्वेश्चन पूछना था मेरा क्वेश्चन सुनना जाना तो क्वेश्चन के लिए हाँ
Hello?
Yes, it's moving, but it's not opened up.
Sir, you said,
Now this is the thing. Yeah, you should go for it.
yeah, fine.
Yeah. Got it. Same ones. Yeah, that's it. Just that, and you can keep moving up. It's moving up, yes. This is how it should be.
Yeah, it's okay.
It's gone again.
Yeah, now it's moving now.
No, it's, this is, you maintain this phase.
Yeah, okay, sorry, sir. Okay.
Yeah.
So the urinary infection, heart infection causes for the kidney disease.
Yeah.
Now the surgery of the catheterization, the low immunity of the body,
Yeah.
the people, obstruction of the flow of urine and anal intercourse also one of the reason, and also food allergies.
Yeah.
And wherever the people are using more dosage of the antibiotics, and also birth control is also one of the reasons for the urinary infection for the ladies. Symptoms I told you: burning of urination, painful urination, and increased frequency of the passing urination. Usually, it is also the reason for the one of the symptoms. And people sometimes also passes red urine. Also here, UTI only. The increased frequency of urination in the night, because the people are going very frequent in the night. Also, this also called the UTI. And also, recently, you can also see the symptoms like the abdomen pain and lower abdomen pain, the fever with the chills and the nausea and vomiting. Also, the UTI causes only. So, in our we are giving categories: physical, sarasapella, narcotic, and bell and memories. But in my experience, I have given caladium Q for ladies where they are having the UTI problem. It is works well for me, because a lot of ladies have given the caladium Q for 5 days, morning and evening. Within 5 days, within 5 days, this UTI problem gets fully vanished. Again, the reoccurrence of the UTI is not at all there in these ladies. In my experience, I have given caladium Q. I also shared it with also Sandu one time also. It is the same. Right now?
Yes, you told me.
Apart from this, I think you may be aware we can use cannabis indica also. We can use for UTI where we are having the urine colic is there. We can use for the cannabis indica.
நமஸ்காரம் சொல்லுங்க.
And also here
கிளாஸ்ல
it is also used where we are having the inflammatory state of symptoms.
அது என்னமோ தெரியல என்கிட்ட. நான் வந்தவங்க எல்லாம் நான் அலோவ் பண்ணிட்டேன். உங்களுக்கு போல எனக்கு தெரியல. அது இப்போ யாருமே பெண்டிங் இல்லை.
That's all from my side. Yeah, thanks, Anu.
We have a contact for the presentation. But can you let us see? Sir, you can stop with your presentation now. Yeah, sir.
Surendra sir.
Yes.
You can take now.
What do you want?
Anything on the kidney or urinary or anything, general topic you can take.
Yes, yes. See, one of the respiratory organ is the kidneys. It has to do a lot of work. Kidneys sometimes are bent on the back of the body, being like shape, connected to urethra by urinary tract, then come back to urinary bladder, then to excretory openings. whether this gets infected or this organ dysfunctions, loses its power to function. Many reasons are. Many
What
reasons.
is your microphone is on, please switch off.
Sir?
Can carry on.
Yeah. So many reasons are there. One is infection of any viral organ, viruses, etc. to the body. They may disturb the activities of is also. For example, the monkeypox. What happens in monkeypox? There will be eruptions and the blood gets spoiled due to germs, and these have to be excreted. While doing so, kidneys gets affected. Yes. Alcohol drinkers, if they take too much alcohol, more alcohol in the blood. Similarly, if they take drugs, so those also disturb the kidneys. Disturb the kidneys, its functions, etc. What happens? Bright's disease is called. Common, general, Bright's disease. What is Bright's disease? Inflammation of kidneys and nephritis. Maybe due to many reasons. One such thing is accumulation of salts because kidney stones are a very common phenomenon. You have hundreds and hundreds of medicines in homeopathy. Hundreds and hundreds of medicines. You have many combinations by this homeopathic medicine manufacturer. What such thing is adult containing, adult. What it does? Acute and chronic urinary tract infection, cystitis, that is formation of cysts, or urethritis, obstructions, also relieves nephritis symptoms and helps the cystophilitis as a part of complex treatment. So you see, you may put it to any combination, but like this, many combinations are there in homeopathy. Even the cancer to the kidneys or any of these organs, they also can beautifully tackle. I also long back told you about cancer, how to tackle. There's nothing to it. Simple medicines, beautiful actions. For example, blood disease you take, I got about 500 medicines. 500 medicines. Benzoic acid, plumbum metallicum, digitalis, colchicum, solidago, which is there, solidago is there in this conflict. Cantaris, lycopodium also plays a vital role, though its action is restricted up to the stomach and intestine. It also makes its own contribution. Acid nitric is the very best in the problems to overcome the Bright's diseases. Second thing is cystitis. That is, cystitis is urination, problems relating to urine. You feel like passing urine, you go to the toilet, you don't pass, you will not come out. Or frequently you are getting, or nightly emission, nightly urination will be used. Or sometimes urine passing through drips and drips. The old age people you see, they put a sack to the penis and they wait. They don't move anywhere. And if they want to take it to anybody, 2 or 3 people must be there to assist. Because urine nerves, filter muscles is not controlled and the bladder is not controlled. So we can medicine for that. I beg to differ. You may in the beginning, but not in the chronic condition. Bulimia, nephritis, they are also come under Bright's disease. Or burning sensation in you, desire for urine, difficulty in passing urine, which is called dysuria. Many medicines are there. Urination, involuntary urination. I already said. It all depends upon the symptoms, the background, as well as frequent urination, polyuria. Then comes hematuria, blood in the urine. Then comes involuntary urine, which is called hemolysis. Then the contents of urine, voluminous, black, alkaline, clone, brown color, sediments, milky urine, oily urine, scanty urine. Then comes specific gravity. This is where this allopaths come in. They are just the urine. Say, your sugar level is more, your potassium level is more, the salt content is less, and all the things you need not worry about it, but you must know what is all that. You must know all those things, but you should not be afraid of, you should not fear for anything. Very beautiful medicines are. One thing ordered with us. Arsenica model makes a first choice model. Then regulating your water intake. That's only you must try to do it. Though in theory you have to take some about 500 milliliters ml for a day, and in summer you must take more. So that's all doesn't come. Sometimes you take more water, but you get more urine than what you take. These are all problems with the organ, but this can be regulated. Vishwambar Das beautifully given the medicine according to the difficulties of symptom process. With the system, beautifully works on the nephritis and kidney. Simple drug, harmless drug. Supposing there's a pain in the urine, Meladona, Chamomilla, or if there's ulceration in the urine, irritation in the urine, when you have pain before passing urine, when you got pain after passing, Vertex vulgaris is passing urine pain. Then to remove the kidney stones, you have been told about it. Medicine. The crux of the point, how to regulate the problem by understanding the symptomatology, taking medicines apart. Here, no one medicine has to be taken constantly. You have to alternately change it. When pain in the abdomen is the beginning of the problem, like a protein, it is coupled with loose motion, China and cardboard established, so your thumb connecting the stomach. Then comes the functioning of the kidneys, urinary response, problems in the legs. This combination beautifully works. But to take this combination, it is called adult routine in German medicine. They are beautifully proven medicine. 20 drops daily once. Within a week, all the tracks are. When there is a pain at the beginning, blood pressure, in the pain at the end, or irritation at the end, pancreas, etc. You can go on taking many medicines. What do you say about poly, excessive use? Napsonica is there, Sinicula is there, China is there, then there is organized conditions to urine. Apis mellifica, Gunain, Hemophilia, symptoms, bedoin, which is liquid with miasmatic problem. Alkaline, bacteria is the best medicine. Cancer is the best medicine. If the urine is in black color, colchicum, lactasis, acid carbolic. So for all problems with the color of the urine, etc. And also for hair problem, acid carbolic beautifully works. When brown color is hypericum, arsenic alcohol, sepia, beautifully works. Urine is very, very poor by possible nitric acid. Fatty urine. What do you mean by fatty urine? Urine is very thick, doesn't pass heavily, only few quantity, but that you can feel by passing urine that it is very, very thick in its starch. Mercurius corrosius, beautiful, greenish urine, greenish color, light green, carbolic acid. Mucus in the urine, that is, it is not clear. The urine is not clear. Some sediment is part of it. Mercurius corrosius, cinephilia, the oily legs, pepper, salt, and ecopodium, etc. Scanty urine. This is very important. During summer, you get these problems. Helleborus, Vitis prolifica, Aconite, Sermonium, Argentum, Metricum, Medsol, Lacasis, Bacteria, etc. Bad smell, acid nitric, sepia, helps. Nitric acid beautifully blocks on this. Many patients have we call it as harsh urine smell. I don't know, I am not experiencing harsh urine smell, but it is kind of that in the homeopathy for acid nitric. Bacteria also comes in. Absinthium, borax, borax is a very beautiful medicine coming up all organs, stomach, intestine, mouth, ulcers here and there, etc. Skin problems here and there. Borax beautifully works. Beautifully works. Hot urine with pungent smell. Got it? Pungent smell. Horribly offensive urine after standing for a short time. Indiago. Ferrum iodide. Smell of urine is sweetish smell. I don't know. You have experienced that. But it has been experienced in homeopathy. Experienced in homeopathy. Horsatella, benzoic acid, natrum sulf also makes a vital part to the war urinary tract. You have to start it only with Berberry sulfate. Beautifully works. I have taken Berberry sulfate many times under during summer. First, when you go to public toilet, there is a possibility of infection. But particularly ladies, cannot pass urine without sitting. They get more infection. So Berberry sulfate beautifully works. The irritation is there at the end of passing urine, you can tell. These two beautifully work and all the time. You have Berberry sulfate tincture and cancer is sixth potency in the house. Whenever there is urine problem, that you will not pass urine. You take some rainwater, or you can take warm water with honey, so that it cleanses the organ. See, people have thought of awareness of the modern way of living without going to the physician. I can see in the WhatsApp, many people criticizing our objective, whatever be the disease, whoever is available, let us take the opportunity to overcome. Our life is important, not criticism. Our life is whoever says, whichever system says, let us use it. Then go to it. Normalizing it by studying this. That is why the elite group wanted you to become more understanding about the organs, functioning, the breathing. Unless you know about your condition, correlated with the nomenclature, correlate with your difficulty, then selective. It is nothing but similarity to the answer. That's all. Why should you do it? Even cancer you can treat it. Added to that, without no sorts, carcinosin is there available, syphilis is available, sodium is available in 3x tablets. If eruptions are there, you take medicine according to the purpose. The body consists of factors or arsenic and organ, some eruptions of arsenic. Don't deal with that. What do? Don't go for sulfur. Our mentor, Pastor Nair, always used to advise us, don't take sulfur directly. Go for sulfur iodide. It's a shape and acts as sulfur. Why? Because sulfur is a medicine. It goes deep into the body. Long-acting remedy, deep-acting remedy, pushes every single morbid matter, foreign matter from the organs, the cells, etc. to outside. Sir, what goes, sir? Long-acting, deep-acting. You see the nomenclature given by the brewer. I am not calling those words. The brewers have coined it. So I also told you long back, when a person abuses himself, his body, he is gone to the homeopath, he has given sulfur, immediately eruptions have come out from something. Symptomatic eruptions. If such eruptions come out, no one on earth can heal it. Whatever the duration, the images will be there, rings or different colors, etc. on the body. It takes a lot of time. Whatever be the potential take, it is very difficult because sulfur has brought them all to the surface. From inside to outside. Above downwards, inside to outside. From a particular. So this is the condition of the body. So urinary problem can be beautifully tackled without going to this dialysis and this and that. Don't go for dialysis. Once you go for dialysis, you are finished. You should not reach to that extent. You must somehow consult your experts. any others, even myself, will give a bit of a save them regularly. But avoid such things for setting factor will be normal in the during watching it within the 15 days, 1 month or so. Thank you very much. I hand it over to Anup.
Thank you.
Sir, Anup Kumar sir?
Yeah, I can handle some things like this.
Yes, yes.
Yeah. So today, in continuation with the urinary system, excretory system, and kidneys and all, I too will have a small presentation now to just make it quick. So I'm not going to deep about I'll just go to directly to the urinary system. Everybody knows we have the kidneys and the ureter and the urinary bladder, which has been discussed here now. So kidneys are a bean-shaped organ which will filter the urine, and the waste urine is passed down to the ureter to the bladder, whereas the recovered ones will be circulated back into the blood by the blood vessels. So this is how the inside of the kidneys will look like. So ureters are muscular ducts that drain the urine from kidneys to the urinary bladder. A human adult has ureters which are usually 25 to 30 centimeters long, and ureters arise from the renal pelvis on the median side of the kidney, and the ureters join the urinary bladder. The opening of the bladder is connected, it is controlled by uretrovesical valves. Uretrovesical valves which will be controlling the urine from coming back into the kidneys. So urinary bladder is an organ that collects the waste excreted of the kidneys, that is the urine, and it is a hollow muscular organ which is distendable and is elastic organ. It sits on the pelvic floor. Urine enters into the bladder via ureters and exits by the urethra. Urethra is a tube that connects the urinary bladder to the outside of the body. It has excretory function in both genders to pass urine out. So both genders have urethra. The male urethra will be longer, female will be shorter. So the kidneys help to remove waste as urine. They help to filter and purify the blood before sending back to the heart. Kidneys perform many crucial functions including maintaining overall fluid balance, regulating and filtering the nutrients from the blood, filtering waste nutrients from the food, medications and toxic substances we have. All residues are filtered by the kidney and passed through the urine. So urine will have sometimes different type of smells. What our Sridhar was telling now, some smell like horse urine, or sometimes it will have sweet smell, depending on whatever is being excreted. If acetone type of ingredients, like an aromatic base, acetone is excreted, then your urine will have fruity smell, sweet smell. If it is very rich in uric acid and ammonia and all, you will have the horse urine type of smell. This uric acid, gout people will also have this uric acid rich urine, and benzoic acid, acid nitricum, all those things will work well when you have such bad smelling urine. Then creating hormones that help urine, the kidney functions in creating hormones that produces red blood cells and promote the bone health and regulate blood pressure. The kidney has different roles. Like one is maintaining the water moisture, the water content of the body. Second is filtering the waste, and also producing hormones, and also to regulate the blood pressure. Nephrons is the part of the kidney, the unit of the small unit of the kidney, which is most important part of the kidney. They take in blood, filter it, and metabolizes the nutrients and help to pass out the products from the filtered blood. Each kidney has 1 million nephrons. Each has its own internal set of structures. The nephron structure you can see Nephron will have a small ball like head called the glomerulus and a Bowman's capsule and glomerulus. So from there we have these convoluted tubes. Then we have the ascending, it's called the J type of this is there, that is called loop of Henle. So it's this U type of tube is called loop of Henle, which has an descending tube and an ascending tube. So both of them together is called the loop of Henle. From there, the urine is connected back into the distal convoluted tube. So first is from the glomerulus, which is there, the proximal convoluted tubes. After the loop of Henle, it is forming into another distal convoluted tubes, and then it is joined to the collection tubes. Any of such collection tubes collect a lot of this urine from the other nephrons, and then it is passed into the pelvis of the kidney, and from pelvis the waste urine will be passing into the bladder to the ureter. So that is what we have already explained now. We will go through on this process. So now we will go to the diseases of kidney and bladder and urinary tract. Disease of the bladder. What are the diseases of bladder? Cystitis. The infection of the bladder is called cystitis. Inflammation of the bladder often from an infection. Some infections like urinary tract infections can also cause. So bladder infection is called cystitis. Then next is called urinary incontinence. That is, you will not be able to hold your urine. Even when you feel like urinating, your bladder is full, you will pass it without even your knowledge. It will be passing, or because of muscular weakness or some sort of infections or inflammations, which is not allowing you to close your bladder mouth properly. Urinary incontinence. So overactive bladder is a condition in which the bladder squeezes urine out in the wrong time. So overactive bladder, you squeeze out the urine before you are ready to go to the toilet, itself it will be squeezing out the urine. So you will be wetting your pants. The other thing is interstitial cystitis. It is a chronic problem that causes the bladder pain and frequently urgent urination. So interstitial cystitis is another bladder issue only. The symptoms of cystitis the symptoms will be strong, persistent urge to urinate. So you will be all the time feeling like I should urinate. Then the burning sensation when urination, passing frequent small amounts of urine, blood in urine or hematuria, passing cloudy or smelly, strong smelling urine is one of the problems. Then pelvic discomfort, you feel like something is there going on in the pelvic discomfort, the feeling of pressure in the lower abdomen and low grade fever. These are the symptoms of cystitis of bladder infection. We have these are the symptoms. Sometimes there will be bleeding, certain hematuria, sometimes there will be strong swelling, and there will be constant urge to urinate. We have homeopathic medicines for that, and because cystitis economic, sudden onset with anxiety. So because of this problem which is not used to by us, we don't normally have a student feeling, and suddenly these are the unusual system changes in the urinary methods. So we will be anxious also. So then we can give Econite, and Econite generally works well because of there is a constant feeling of going to pass urine, and we see Econite works well. Next is stinging pain and all will be there sometimes. So if this men will work, there is a constant urge to pass it. Belladonna is like this problem has suddenly started. So the belladonna works sudden onset. Cancer is most indicated remedy for cystitis. Constant desire to urinate, cutting pain before, while and passing urine. So the total process of urination will be painful. From the starting, while passing, and then after passing also it will be painful. So cancer will be the best medicine. Phosphate is the first stage of cystitis. Nux vomica, an irritable, impatient, chilly person with an irritable bladder and constantly need to urinate. So all the time he wants to keep on passing urine. Such people, Nux vomica works. Urinary incontinence, which is important. So for that, arnica is a valuable remedy to be remembered for incontinence after surgery. Sometimes because of certain surgical conditions and all, these things happen, and arnica helps to heal the problem, and this incontinence because of surgery can be controlled. Patients tend to dribble urine when cold. So that is belladonna. When it is cold, slowly urine escapes. Maybe having burning pains around the neck and the urethra during urination. While dreams, often dreams of urination. He in his dreams he is urinating, and when he wakes up he sees that his sweat or pant is wet. So that is a period about sweat. Then caustic, involuntary urination worse in winter and better in summer. So during winters definitely our urine methods, the sweating will not be there mostly. So more urine will be there, and winter time this issue will be more. Fears of something bad happening to us, apprehensions while happening and expectations while urinating, thinking much in the time of urinating. Fear of sleep in the dark. The urine slips out when cough and sneezing and or laughing. So causticum is that medicine which will help you to control the urine which is slipping off when you cough, sneeze or laugh. Equisitum, urine drips out for no reason. For no reason it will be slipping out. No other obvious symptoms are there. The drips of urine will just escape from your body, and there is no specific reason for that. So that equisitum will be the best medicine. Patient has white dreams and nightmares of bedwetting. So his dreams will be about bedwetting, and then he will be really physically bedwetting also. So they tend to dream of crowd of people. They will be always thinking they are the crowd of people. Urinary incontinence, we have another medicine called Berophos, which is most effective urine dribbling off at daytime, especially when standing. When you stand, urine escape off your system. That is Berophos. The urge to urinate reduce. The urge to urinate reduces when you lie down. When you stand up only it is there. When you lie down, the pressure on the bladder water is not there, so you will not have it feel. This is clear circle. Patient has sudden urge to urinate and do not have time to reach the toilet. So he will feel like urination before he opens the bathroom door. He will have already wet the floor. So then bedwetting during the first part of the night. So immediately after or something after you start, you will be wetting your bed. So these are best medicines. Clear circle is the best medicine. And he may also have this dream of wetting urination. The next is lycopodium. Patient is very anxious, constantly worrying about others, what others may think of them. So this is the thing, they already have incontinence, and also they will be worried like what others will be thinking of them. Here, to try anything new. Bedwetting is sleeping in warm room, stuffy room, so prefer an open air. Creosotum, sudden urge to, that is overactive bladder as another symptom what we discussed. Again, creosotum comes in here. So urge to urinate suddenly, when frequent urge is there, and urine usually highly offensive smell is there. So that is what. Next is lycopodium, frequent urination of large volumes of urine at night. Bearing down, feeling on the bladder, wakes up at night due to urge to urinate. They have stitching pain in the bladder, also helpful for frequent urination in males with prostate gland enlargement. So prostate gland enlargement will be there for elderly males, and for them frequent urination will be there in the night because they feel the bladder is full and they will not have complete evacuation. So little when the urine trickles down in the bladder, they feel the bladder is full and they will run out to the toilet even in the night of the sleep. Blood salt, frequent urination during the daytime and at night. Both times, day and night there is frequent urination. Hurry to pass urine, when the urge orange, urine will be involuntary. So if you do not make it fast and urine will escape out of the system, that is blood salt. Scanty or profuse urine, bladder may feel sore. Bladder will feel like it is pain or itching or aching. Causticum is another medicine for involuntary flow of urine, helps in strengthening the bladder sphincter and control the urinary incontinence. Then phosphoric acid is helpful when the person passes large amounts of clear, watery urine, mostly at night. Weakness may occur. After passing a lot of urine, we may be tired also. Phosphoric acid is medicine. Feeling bladder is full constantly, passes large volume of urine frequently, but fullness is not reduced. Even after passing the urine, we feel the bladder is full, so he will have to keep on passing again and again. When they pass involuntarily both in day and night also, he will be passing urine. Sepia, useful for women patients, who has sudden and uncontrollable urge to urinate. Women who are having uncontrollable urge to urinate, sepia, constant bearing down sensation in the pubis, pain or feeling like something is not there under a hold at the pubis, bearing down feeling. In most cases, the urine is foul-smelling and may contain sediments also, again sepia. Interstitial cystitis, the disease is known to cause is of unknown cause, but homeopathy can give significant relief for the symptoms. Recurring infections affecting the urinary bladder can be reduced drastically and reducing the need of antibiotics. So some commonly used homeopathic medicines for interstitial cystitis is sepia, Staph aureus, Medeorinum, Cantharis, Lycopodium, Calcarea sulf, Equasulf, Calical. So again, some common homeopathic remedies for interstitial cystitis is sepia, Staph aureus, Medeorinum, Cantharis, Lycopodium, Calcarea sulf, Equasulf, and Calical. These are chosen symptomatically by review and case studies. So common kidney diseases, the acute kidney failure, chronic kidney failure, kidney stones, and urinary tract infections. So these are the common kidney diseases. So we will go back one by one. Acute kidney failure occurs when the kidney suddenly become unable to filter waste products from the blood. When kidneys lose their filtering ability, dangerous levels of waste accumulate and blood will lose its chemical makeup and balance, because blood will have a lot of waste which has to be removed, but it's not removed. So this is the stage when people have to go to dialysis, and our Sudhir said we should not allow our system to reach to this level and go for artificial dialysis. Our treatment should be done much before that and before the nephrons fail. So there are stage-by-stage treatments, and mostly the problem with kidney is when for the kidney diseases will be expressed by the patient only when both kidneys fail, because we have two kidneys, and when one kidney fails, the other will take up full-time job, and then finally both will fail. So we have to be very careful when we see any abnormal kidney. We should not make the kidney totally fail and then try to recover it. Symptoms is decreased urinary output, but at times may be normal. Fluid retention, that is, will be swollen up blood depth, edema will be there, fluid retention, causing swelling in your legs, ankles, or feet, shortness of breath, irregular heartbeat, fatigue, confusion, nausea, and weakness. These are the symptoms of kidney failure. So again, for homeopathic treatment, we have good treatment. Arsenic album, we have high blood creatinine, scanty urine, burning when urinating. Albuminuria, that is when you urinate, your urine will have albumin, the protein which is supposed to be absorbed back, and that is lost because of kidneys malfunction. So albuminuria, epithelial cells will be there, fibrin and clots will be there, so because of bleeding. Clots will be there, pus globules and blood in the urine can be seen. Feel weak as the abdomen after urination, retention of urine, and urine black as if mixed with dung. So some color of the urine will be like not transparent or yellow, it will be black in color as if it is powder is mixed with that. So these sort of problems, arsenic album can be remembered and treated. Lycopodium, effective remedy for high blood creatinine and scanty urine. So thrice before urinating, because of pain you will be crying before urinating, and red sand in urine. So urine will have red sandy deposits and must strain to pass urine and suppressed or retained urine. So urine can be leaky or turbid in color, turbid milk water, leaky or turbid in color, sometimes hematuria, where the blood will be there in the urine is burning and hot. Then the right kidney is mainly normal. So Lycopodium can be remembered. Next is epismel. Epismel effective when there is edematous swelling in the face and extremities. Like the legs and hands and face can be swollen, and there is no thirst also. Epismel to be remembered. Frequent but scanty urination. The urine will be frequent, but urine which he passes will be very less. He is suffocated and breathing will be difficult, worse from heat and better from cold. So it is well. Cantharitis, again, a suppression of urine with restlessness, flushed face and sparkling eyes, ineffectual urge to pass urine, bladder is empty. So this is Cantharitis. And belladonna, uremia is in healthy patients, and kidney ceases to function. So urine becomes dark and turbid. There is muscle twitching and violent convulsions. So belladonna in these conditions. Blood clot, narcotis, corrosion. That is what we discussed now. We have albuminous scanty urine, blood clot, which is hot and burning. Passed drop by drop or is suppressed. So urine will pass in drips and drops, and it will all be suppressed. Bloody venous discharge can come to the opening period of weight, and tenesmus of the bladder, stabbing pain extending up to urethra or the bladder. Severe lumbar pain. So the lumbar area, kidney areas will be pain. Cuprum arsenicum is very effective for renal failure with high level of creatinine in the blood, kidney inefficiency and anemia. Urine smells like garlic. Urine is of high specific gravity. Our Subramanian sir mentioned about specific gravity. The specific gravity is high because it accumulates a lot of waste which is supposed to go out. So the urine specific gravity will be more, and increased acetones and diacetic acid. So acetones, when there is I told you, there will be sweet smell, and acetic acid will be having the vinegar type of smell. So diacetic acid smell will be there, or urine will be, the specific gravity will be increased. Other indicated remedies are like cuprum aceticum, serum albumin, and this is neem serum, and then Arabia hispida, and terbinth and urea. So all these medicines are very wonderful and will handle the acute kidney failures. Now we will talk about chronic kidney disease. Chronic kidney disease is the long-term issue, and disease rarely shows up the symptoms until it reaches the advanced stage. This is what I said. If the chronic kidney stage will not be known, suddenly you will have these other things which can be cured, and maybe you are lucky. If you are lucky, you can be cured. But when you are in the chronic stage, the stage will be known only when you are totally gone. The chronic rarely shows symptoms until it reaches the advanced stage. So periodic health checkup is necessary for people who are at the risk. As opposed to acute kidney failure, this is a slow and gradual progressive disease. Both functions normally with one, body functions normally with one kidney. So the diseases will not be known will be known only when both kidney fails. Most damages are irreversible. Most common signs and symptoms include weight loss and poor appetite, swollen ankles, feet or hands will be swollen due to water retention, edema, shortness of breath, and tiredness will be there. Urine will be blood is in the urine. Frequent urge to urinate, particularly at night. Difficult sleeping, insomnia will be there, and itching in the skin. Then the medicines for chronic kidney failure is again smell, it will cause swelling, and edematous face painless, headaches, pain in the back and limbs, dull ache, kidneys, reduced urination, and urine contains blue abdomen and high levels of blood corpuscles, skin eruptions, and patients feel drowsy. Arsenic album, one of the best remedies for these are chronic kidney failure. Skin will be pale and waxy, excess thirst and diarrhea. Dark rich urine, and voice will be hoarse, seen while lying down at night. Belladonna is ideal for treating kidney inflammation with piercing and burning pain in the lumbar regions. Pain reappears repeated, then it increase intensity each time. So pain will come back to that higher intensity next time. Cantharitis is used for nephritis, cutting pain in the lumbar region. Urine contains blood. Urine flows in drops. Coronary and muriaticum are the other indicated remedies. Kidney stones. Suresh also has discussed kidney stones. So we will see again kidney stones, what are the kidney stones and how it is formed and all. Kidney stones are renal calculi, renal calculi. They are solid crystalline masses. Kidney stones usually originate in your kidneys, but they linger anywhere along the urinary tract, like bladders or urethra. Kidney stones are one of the most painful medical conditions. and the causes of the kidney stones vary according to the type of stones. The type of kidney stones are calcium phosphate stones are there, calcium oxalate stones are there, uric acid stones are there, stromoid stones are there, cystine stones are there. All these things depending upon what chemical it is made up of, and that's how it's called different types of kidney stones. So in whichever form of kidney stones, we have to use our homeopathic medicines to remove it. Berber's vulgaris cube, that is for the tincture, is the best remedy for kidney stones. And the pain is on the left side, and it helps to balance and prevent the formation of excruciating calcified deposits. So removing the deposits and prevent the formation of these calcium deposits. Pain is stitching, cutting from the left kidneys, placing the course of urethra into the bladder and urethra, cures the pain and helps to pass the kidney stones. The Berber's vulgaris cube can be continuously had. The hydrangea is very effective for when the gravel of the stone are large deposits of white amorphous salts in the urine. Calculus and renal coli will be there, renal coli in the kidneys will be there, and blood in the urea. When the stones move, it can cut the passages and make the blood loose out. It acts on the urethra and is indicated as a pain in the lumbar region. Difficult bloody urine while with heavy deposits of mucus. Renal stones with great thirst, abdominal symptoms and enlarged aportate. So hydrangea is working very well in this area. Other indicated remedies are Torrevia brava Q and Cantharis, lycopodium also. The urinary tract infections is a big problem, and as I said, for men it is less, but women it will be more, because the only reason is their men, their urinating method is different, and also the urethra is little longer, and for female it is short. And that is why they are prone to more quick infections. The symptoms are burning while urination, frequent or intense urge to pass urine, even though quickly urine comes out. Cloudy, dark, bloody or strange smelling urine will be expelled. Feeling tired or shaky, fever or chills, sign of kidneys are infected. Then pain or pressure in the back and the lower abdomen. Cantharis, Naxomica, Salsaperla. These are the three medicines. Cantharis, strong urge to urinate, cutting pains before urination, and as well as during and after urination also there will be pain. Only some drops of urine pass at a time with severe pain and burning. Feels as if bladder is not empty, so constant urge of urination will be there. The Naxomica, inflammable bladder and with the constant urge to urinate, pass only small amounts. May feel burning or cramping, pain will be there, itching in the urethra. While urine passes, internal move and will feel chilly. Then symptoms better with the hot parts or during warm, when you be warm, it will feel better. Sarsaparilla is very useful for cystitis, and it is also for unclear symptoms or with other remedies fail. Frequent urge with burning pain at the end of the urination. Urine passes when standing up, but only dribbling while sitting. Urine with flakes and sediments. That's enough for such indications. The other symptomatically indicated remedies include reconnite, Apisprin, Belladonna, Berber's vulgaris, Borax, Chimaphila, Clematis, Epicitum, Lycopodium, Sepia and Stratoseveria. These are all medicines are already discussed many times, and these are all to be remembered. So that's all with this session. So I'll stop. Thank you, sir, Professor Alpha.
So thank you very much, sir.
Thank you.
Today class has gone on kidney stones and kidney failures and everything. And
We are mixed several channels also.
that we'll discuss. We'll discuss sir, afterwards.
So that is for prostate gland enlargement also.
Yes.
Yes.
Yeah.
Many thanks to Suresh Rao sir, Anup Kumar sir and Surendra sir. Because time is over, 5 minutes more. We will take leave. Next week we will meet. Thank you very much.
Thank you, sir.
Thank you, sir.
That's very nice, sir.
Thank you.
you.
Thank you, sir.